Though I will discuss the importance of the dietary lipids today, but that we must go through the definition of nutrition that has already been told to you by the Dr. Amna and Dr. Chami. But we should have a recall. Nutrition is a science or a study of food and the way the body uses that food. Now, and what are nutrients? Nutrients are the substances in food. They provide energy to the body and help the body to form tissues, and nutrients are necessary for life and growth. As far as the nutrients are concerned, nutrition is concerned, the human body requires six major type of nutrients. We have just discussed nutrients are the one which provide energy to the body and they provide a material to build body tissues. Now, out of these six major types of nutrients, three are macromolecules, that is proteins, carbohydrates, lipids. Besides that, we need vitamins and minerals, which are called micronutrients because they are required in small amount, either in milligrams per deciliter or in micromoles per liter. And we also need dietary fiber. So these are the six major components which body require, or which are the components of the balanced diet: three macromolecules, two micronutrients, vitamins and minerals, and dietary fibers. Now, out of these six nutrients, they all not provide energy, but they are still important, like water and fiber. Micronutrients are required, as I told you earlier, in smaller amount, and they have a role in release of energy from the macronutrients. Vitamins, they are vital because they are necessary. Most of the vitamins, they cannot be synthesized by the body, so we have to take in diet. Though exemption is there, there are four vitamins which are to some extent are being synthesized by intestinal microorganism, and among these is the biotin, we have riboflavin, folic acid, and one of the fat soluble vitamin, that is vitamin K. Now this picture shows you the function which are being served by various nutrients in the body. You can see the macronutrients are being shown with the bluish green color, and among these macronutrients you can see that the carbohydrates and fats, they mainly being used by the body for energy purposes. When we say energy, it means these are mainly provide ATP to the body. And if you see, just concentrate on proteins, they are providing us amino acids, and these amino acids can be used for the synthesis of various proteins required by the body in the liver, as well as they have various functions like maintenance of the colloidal osmotic pressure and then transport, or they can serve as a component of glycoprotein. So as far as the energy is concerned, mainly the two macromolecules, that are the carbohydrates and fats, are being used for ATP synthesis, proteins for bodybuilding, but in conditions where the patient is suffering from the prolonged starvation or fasting, then and the body stores of the carbohydrates and fats are depleted, then proteins being used in those circumstances for production of energy by catabolism of the individual amino acids. Beside, if we can look at the fats, they provide energy. They are being used as a component of the glycolipids, and beside that, various type of the lipids, that is the conjugated lipids like phospholipids, which are the component of the cell membrane, prostaglandins, leukotriene, thromboxane, which are collectively called as eicosanoids and have various functions in the body. And you can see the link that vitamins and minerals are being utilized by these macromolecules for to serve these functions. Whenever we discuss nutrition, we always discuss it under three heading, that is optimal, under, and over nutrition. And optimal nutrition is that when the nutrients are being consumed in sufficient amount so that they can support body for day-to-day needs, and they can meet the increased metabolic demands like during illness or pregnancy. Under nutrition means when nutrients are being taken in insufficient amount to meet the day-to-day needs of the body or to meet the metabolic demands. Those individuals which are at risk of undernutrition, they are infants, pregnant women, low income people, and people who have been hospitalized and they are on parenteral nutrition. Because of the undernutrition, the individuals may develop uh, impaired immunity, and their growth will be impaired growth, as well as they are prone to develop infections. Their wound may be they will not be healed promptly. And overnutrition is consumption of nutrient in excess of the body needs. Optimal nutrition or ideal nutrition is that an individual is receiving and using all the essential nutrients which I have already mentioned to maintain health and well-being at the highest possible level. Undernutrition is a lack of adequate energy. Let me repeat. Energy, when we use the word energy, it means we are talking about the carbohydrates and lipids. So undernutrition is not only the carbohydrates, lipids, and proteins are deficient, but the micronutrients are also utilized in less amount to meet the basic requirements of the body for maintenance, growth, and development. The undernutrition can be because of many reasons. Either there's inadequate food intake, or the food is being taken in adequate amount but the absorption from the GIT is compromised, or even they are taken in adequate amount, absorption is there, proper absorption is there, but the body is losing those nutrients either in the urine or in the feces due to some pathological conditions. Now we first discuss why dietary lipids are important to take as a nutrients. The first thing which goes in favor of dietary lipids is that they give taste to the diet. And number two, the body is adept to unlimited storage of dietary lipids. If we are consuming dietary lipids in excessive amount, body can store it as triglycerol to an unlimited amount. The second point is that they have a high energy value, and they provide more energy per gram than carbohydrates and protein. If you recall, carbohydrates and proteins, they give 4.1 kilocalories per gram, but 1 gram of lipids give 9 kilocalories per gram. The reason is, if you concentrate on the structure of fatty acids, every carbon of the fatty acid is fully saturated. So they are they are anhydride form. They are carbons valencies are saturated and they are anhydride. Anhydride means they are without water. If you recall the structure of carbohydrate, for every carbon there is a one water molecule. So being a fully saturated molecules, they give more energy than the carbohydrates and the proteins. And then these dietary lipids are the source of the essential fatty acids. Let me repeat, essential fatty acids are those fatty acids which cannot be synthesized by the body and we have to take it in the diet. Essential fatty acids are linoleic, linolenic acid, and arachidonic acid. These dietary lipids are also source of provision of fat soluble vitamins like vitamin A, D, E, and K. This picture gives you the brief description of the important functions which are being served by fat soluble vitamins. If we go for vitamin A is present in the body in three different forms, that is retinol, and retinoic acid. And this retinol, the aldehyde form of the vitamin A, is important for night vision. Then its role in reproduction and cell differentiation and growth is by promoting the synthesis of the glycoproteins and heteropolysaccharides. Beside this, it is important for bone health and for boosting of the immune system. Vitamin D, we all are very well aware that they promote calcium absorption, dietary calcium absorption from the GIT, and they promote those calcium deposition into the bones, so they strengthen the bones. and beside that it has almost 36 functions. In those 36 functions, it boosts our immune system. Vitamin E plays a role in immunity in a sense that it is an antioxidant vitamin. An antioxidant vitamin is that vitamins which reacts against free oxygen radicals. You all are very well aware that every cell is being uh, protected by the plasma membrane or the cell membrane, and the membrane phospholipids are mostly unsaturated fatty acids. So these unsaturated fatty acids of the plasma membrane are subject to these free oxygen radicals. Free oxygen radicals can damage these unsaturated fatty acids. So what happens, this vitamin E stabilizes plasma membrane. This unsaturated fatty acid itself, it get oxidized, but it prevent uh, this per oxidation of the membrane phospholipids, and that's why it is acts as an antioxidant. As far as the vitamin K has been considered, it has very important function. Number one, it has a role in blood clotting. It causes activation of the coagulation factors by promoting addition of the carbon dioxide into the glutamic acid residues of the various clotting factors, as well as it has a role in the bone health, in a sense that in this osteoid matrix of the bone is formed by collagen, osteocalcin, protein C, protein S, and these are the sites where the calcium get deposited. So it also causes carboxylation of the glutamic acid residues of these proteins, so that the calcium can be deposited into the bone. So in beside vitamin D, vitamin K and vitamin A are also being required for the bone health. This slide shows you the two other important functions of the dietary lipids, and one of the function is that they are important constituents of nervous system. Lipids in the form of cerebrosides and gangliosides and sphingomyelin, they are the components of our nervous system. Beside, the tissue fat is an essential constituent of the cell membrane and the nervous system. And mainly remember, phospholipids which are not affected by starvation. So any type of starvation or dietary limitation cannot affect the membrane phospholipids. This slide shows you the structure of the lipid bilayer of the cell membrane. And you are all very well aware, we have been through this a number of times, that this lipid bilayer is made up of phospholipids, and phospholipids they may be saturated or they may be unsaturated phospholipids. Beside phospholipids, the other lipids which are the constituents of the cell membrane, they are among phospholipids we have glycerophospholipids and we have sphingophospholipids. Among glycerophospholipids, if you recall, we have discussed in the introduction of the lipids in the chapter, that glycerophospholipids are phosphatidylcholine, phosphatidylserine, phosphatidylinositol, and sphingophospholipids are sphingomyelin. Among glycolipids means when the lipids conjugate with the carbohydrates, we have galactolipids. Galactolipids is a galactocerebrosides. So galactocerebrosides and sphingoglycolipids are glucocerebrosides and gangliosides. So galactocerebrosides, glucocerebrosides, and gangliosides are glycolipids. And beside these lipids, we have certain sterol molecules as a constituent of the cell membrane, like cholesterol. So if you recall, the cell membrane also have a cholesterol, which is a amphipathic molecule. As I have told you earlier, that body is adept to the storage of unlimited amount of dietary lipids if they are being taken in excessive amount. So body stores excessive lipids in the form of triacylglycerol, and these triacylglycerols are being deposited in the body tissues where they don't interfere with the mobility. Mainly these triacyl glycerols, they are being deposited at the site like anterior abdominal wall, buttocks, hips, thighs, and breast. So these triacyl glycerols are the stores of energy, and body utilizes these stores of energy in the time of this carbohydrate deprivation. Beside being the stores of energy, these depot fats or stored fats, they give protection to the internal organs from the shock. So, and they also serve the function of thermal insulator against the loss of heat. As lipoproteins, lipoproteins are conjugated lipids when the lipids conjugate with the protein for transportation purposes. So these are conjugated lipids or complex lipids, and they are also the cell part of the cellular and subcellular membranes. Then one of the straws, as I discussed, cholesterol as a component of cell membrane. Beside being a component of cell membrane, cholesterol is very important for the human health, and it is beneficial molecule except when it is being present in the higher concentration. Cholesterol being used for synthesis of a number of hormones like estrogen, progesterone, testosterone, cortisol, aldosterone. It is also a substrate, a raw material for the synthesis of vitamin D3 and the bile acids. Bile acids are, you can say, they are the excretory form of cholesterol, number one. And number two, bile acids are required when we consume lipids in the diet. For digestion and absorption of the dietary lipid, bile acids are a requirement. For every macromolecules, when we discuss their biomedical importance, their role in the body, we do discuss the disorders which are related to these macronutrients. So today we will discuss few of these disorders, that is the obesity, and what happens when the essential fatty acids are deficient. And if you recall, we have already discussed the respiratory distress syndrome, which was caused by the deficiency of the membrane phosphatidylcholine, which serve as a surfactant. As we discussed earlier, that the dietary lipids are the source of essential fatty acids. So this is a list of certain functions which are being served by essential fatty acids. Essential fatty acids are those fatty acids which cannot be synthesized in the body, and we have to take these fatty acids in diet. Now, these essential fatty acids, they are component of the plasma membrane. They have a role in the cholesterol transport. They are the component of the lipoproteins. And the most important thing, and these essential fatty acids, especially the arachidonic acid, which is a polyunsaturated fatty acid. It is a 20 carbon fatty acids with the 4 double bonds, and it is a substrate. It is a membrane phospholipid. Remember, arachidonic acid, an essential fatty acid, a membrane phospholipid, and it is a raw material for the compounds which are called eicosanoids. Eicosanoids includes prostacyclin, prostaglandin, leukotrienes, and thromboxane. Then we classify these essential fatty acids into two families, that is omega-3 and omega-6. The linoleic acid family is called omega-3 fatty acids, and linolenic acid family is called omega-6. In the next slide, I will explain you on what basis we call them omega-3 and omega-6. Now, this is being proved that omega-6, PUFA stands for polyunsaturated fatty. Why we say poly? Because they have multiple double bonds and they are unsaturated. Unsaturated means they have double bonds and multiple double bonds. So this omega-6 PUFA, they decrease serum cholesterol, and omega-3 decreases platelet aggregation. So omega-3, when they decrease platelet aggregation, it means they are decreasing the heart risk. And these essential fatty acids are the substrate for the ketone bodies. If you recall, ketone bodies are the alternate source of energy when the glucose is not available to the brain and the skeletal muscles. Now, in the diet, we consume three different forms of fatty acids: the saturated fatty acids, monounsaturated fatty acids, and polyunsaturated fatty acids. Saturated fatty acids are those fatty acids in which every carbon valency is fully satisfied. There is no double bond. Monounsaturated means mono means one. When a fatty acid having one double bond in its structure, and oleic acid is a 18 carbon fatty acid and have a one double bond. So that's why it is called as monounsaturated fatty acids. Among oleic acid, we have the examples of the this peanut olive oil and peanut oil. Then polyunsaturated fatty acids, PUFA. You can see here this is again an 18 carbon fatty acid but having two double bonds. So two double bonds, linoleic acid, 18 carbon fatty acid with two double bonds, and it comes under the category of the polyunsaturated fatty acid. Now this picture will more elaborate you and enable me to explain you on what basis we classify PUFA, the polyunsaturated fatty acids, as omega 3 or omega 6. If you see under the saturated fatty acids, we have 16 carbon fatty acids with no double bond, that is palmitic acid, and stearic acid, that is 18 carbon with no double bond. Then, as we discussed earlier, monounsaturated fatty acids or MUFA, oleic acid is 18 carbon with one double bond and at a position of 9. All double bond in naturally occurring fatty acids are in cis configuration. Here you can see oleic acid 18 carbon with one double bond, and the double bond is at the carbon number 9, and it is in the cis configuration. Now polyunsaturated fatty acids are then again classified into omega 3 and omega 6. You can see if a structure of a fatty acid, on one hand it has a carboxylic group, that's why it is called as acid, and on other hand it is a methyl end. Usually we count the number of carbon from the carboxyl end, but if we count the double bond from the methyl end, then it will be called omega. So linoleic acid, which is an 18 carbon fatty acid with the 3 double bond, the third double bond is at carbon 3 from the methyl end. That's why it is called omega 3. I am again repeating, when the position of the double bond is being seen from the methyl end, then it is being called omega. So linoleic acid family has got a double bond from the at carbon number 3 from the methyl end. Whereas if you see linoleic acid, again it is 18 carbon fatty acid and with two double bond. So the first double bond, if we count it from the methyl end, it is at the carbon number 6. So that's why it is omega 6 fatty acid, and linolenic acid is omega 3 fatty acids. Arachidonic acid is also being included among the category of the omega 6 fatty acids. As I told you that when we consume dietary lipids, it may be saturated, monounsaturated, and polyunsaturated. So what are the effects of these lipids which are present in diet on our lipid profile? Saturated fatty acids or saturated fats are those which have no double bond in their structure, and they are usually solid at room temperature. If you recall, the examples are ghee, butter, margarine. So these when we consume saturated fatty acids or saturated fats, they inhibit the receptor mediated uptake of LDL. Now what happens, the LDL stands for low density lipoprotein. Dietary lipids are being absorbed from GIT, then they are being brought to the liver, and then liver again package them in the form of a lipoprotein that is called VLDL. That VLDL, when comes into circulation, it is converted into LDL. So LDL is actually the form of the lipoprotein which transport cholesterol from liver to the peripheral tissues. And when this LDL molecule reaches to the target tissues, it is being taken in by receptor mediated mechanism. The receptor recognizes that LDL molecule, and then it has been taken in by endocytosis. So saturated fatty acids, they inhibit the uptake of LDL by the target tissue. So it means that levels of the lipids will be increased in the circulation.
Then palmitic acid, which is we have just seen that it is 16 carbon saturated fatty acid, it has been blamed to increase cholesterol level. And stearic acid, which is a 18 carbon fatty acid, saturated fatty acid, it is neutral. Polyunsaturated fatties, we have already been through this, what are polyunsaturated and what are monounsaturated. The one thing which is doesn't go in favor of polyunsaturated fatty acids are mainly obtained from the plant origin. Vegetable oils are the best example of the polyunsaturated fatty acids, and they are less palatable as compared to the ghee or this margarine or butter. So polyunsaturated fatty acids, they are good in sense that they decreases both LDL and HDL cholesterol. Now here we are using two terms, LDL cholesterol, which is being blamed as bad cholesterol, and HDL cholesterol, which is called as good cholesterol. LDL cholesterol is bad in sense that it, number one, it transport this fatty acids or cholesterol from liver to the peripheral tissues. It is a LDL cholesterol is a transport form of cholesterol from liver to the tissues, number one, where HDL cholesterol is the form of lipoprotein which carries cholesterol from peripheral tissues to the liver. Okay, so polyunsaturated fatty acids, they decrease both the levels of LDL cholesterol as well as that of the HDL cholesterol. Oleic acid, oleic acid is monounsaturated fatty acid. It is MUFA and it decreases LDL, but it has no effect on the HDL level. So it is good in sense that it is decreasing the bad cholesterol, but it is not affecting the good cholesterol. The omega-3 and omega-6 polyunsaturated fatty acids have different effect on lipid profile. Now, we'll discuss this lipid profile in the next class. Then, but this is a conclusion that most foods which are high in saturated fatty acids, when they contain palmitic acid or stearic acid, they are atherogenic. Atherogenic means that they may cause narrowing of the blood vessel. They may be responsible for the formation of atherosclerotic plaque. And when the blood vessels are being narrowed, the blood passage will be disturbed. Less blood will flow through this, and it may lead to the ischemia or heart attacks. Atherogenic. Oleic acid, examples of oleic acid are olive oil and peanut oil, and they are considered as beneficial as polyunsaturated fatty acids. So saturated fatty acids are mainly blamed for increasing the LDL cholesterol, bad cholesterol, and they may cause narrowing of the blood vessel. Now, as as far as the functions are concerned, when we are consuming in the optimal amount, if you recall, we have discussed nutrition under three heading: optimal, under, and over nutrition. Problem arises at the extreme. When the intake of the dietary lipids is less, definitely there will be deficiency of essential fatty acids. So what will happen usually, though it is not very common, but it may be observed in those infants which are being fed on artificial formulas and which are deficient in essential fatty acids, or those hospitalized individuals which are on parenteral nutrition. The major sign, the most important sign, is scaly dermatitis. This is the sign of the deficiency of the essential fatty acids. Beside this, alopecia. Alopecia means the loss of hair. Thrombocytopenia, when the platelet count is decreased, and it also affect the this IQ level of the individual, that is the intellectual disability. Because if you recall that these lipids have a role in the nervous tissues as gangliosides, cerebrosides, and as galactocerebrosides. And the good thing is that if we replace the deficient essential fatty acid, the condition can be reversed. This is a picture of a patient which is suffering from the deficiency of the essential fatty acids, and you can see the scaly dermatitis. Now, depends upon the diet we consume. When I say diet, it means the lipid content of the diet. So this diet have effect on serum cholesterol, as well as it have some other risk factors for heart diseases. Now remember, cholesterol is good for health when it is in normal concentration, because we have just been seen that cholesterol is a substrate for this vitamin D, bile acids, bile salts. It is the substrate for steroidal hormones like estrogen, progesterone, cortisol, aldosterone, and beside that, it is a constituent of the cell membrane. It is hazardous for health only when its levels are increased, and it may contribute to the risk to the heart diseases. Now, four dietary components, they mainly affect the serum cholesterol level. First of all, cholesterol itself, then the PUFA, that is polyunsaturated fatty acids, consumption of saturated fatty acids, and the dietary fibers. The normal ratio of PUFA to SFA. SFA stands for saturated fatty is 2.5 is to 1 and 5 point is to 1. So one can have the normal levels of serum cholesterol if we increase the ratio of PUFA to SFA in the diet. Number two, water soluble fibers. They have a role in decreasing the cholesterol concentration significantly. Here, I must tell you one important fact that one egg which we consume, the egg yolk contains 215 milligrams of cholesterol. So as I told you that cholesterol itself, so dietary cholesterol has its own effect on its. And here one more important thing, that the brain has the highest levels content of cholesterol. So beja fry is the richest source of cholesterol. So one must be aware of which type of diet this red meat is having a high content of this cholesterol. So the type of diet we are consuming, and the cholesterol content it has having it. As far as this omega-6 family, which we have already discussed, that is the linoleic family, which has been obtained from plants and vegetable oils, they decrease cholesterol level and they have a modest effect on triacylglycerol. See, when we say lipid profile is not a single test. It has 7 parameters, and one two of its parameters is that we go for the estimation of serum cholesterol, that is the LDL cholesterol, HDL cholesterol. We also go for the triacylglycerol levels also. So omega-6 family decreases cholesterol, as well as it has a modest effects on the TAG levels. Whereas the omega-3 family, which is being obtained from the ocean fish and the fish oils, it causes modest decrease in the serum cholesterol levels, and it has a significant effect on TAG level. It decreases TAG level to a significant level, and it's also decreases platelet aggregation. So you can see here, you can compare here that omega-3 is more beneficial for health as compared to omega-6, because omega-3 decreases platelet aggregation, which is also decreasing the risk for the heart. It has a low, it affects more, significantly lowers the TAG level, and it do decreases the serum. Now, as I told you that problem arises when we are at extremes of intake. As we just discussed, that if the intake of the dietary lipids is less, the deficiency of essential fatty acids may take place. What happens if we consume excessive amount of fat when we are at a high levels of the scale? So this high fat intake is mainly associated with the increased risk of a number of cancers like colon cancer, breast cancer, and prostate cancer. Now, it has been not so far being proved that whether this cancer is because of the dietary fat itself, or it may be because of the polyunsaturated fatty acids which are belonging to the omega-6 series, because it has been said that this omega-6 fatty acids, they are a source of the prostaglandins, and the prostaglandins, they stimulate the progression of the uh, tumor. Now, excessive consumption not only leads to the risk of a number of cancer, but it may lead to obesity. The obesity is not mainly because of the excessive consumption of the dietary nutrients, but it also some other factors are also being blamed for this, that is physical inactivity and the genetic factors. So what happens? The excessive consumption. Remember one thing: excessive consumption of macronutrients, whether carbohydrates, proteins, or lipids, they all will add to the body nothing but the triacyl cholesterol. I will again repeat: excessive consumption of all these three macromolecules, proteins, carbohydrates, lipids, they will add to the body only TAG. And kahan TAG will go and get deposited into the adipose tissue, anterior abdominal wall, buttocks, hips, thighs. So it contributes to it will lead to obesity. Dr. Jamil have been given you a lecture on obesity, and he must have been told you the consequences of obesity, that obese person, 80% of the obese person, they are the victims of type 2 diabetes mellitus, that is non-insulin dependent diabetes mellitus. They can be subject to the increased blood pressure and the stroke. And dyslipidemia actually is that their lipid profile will be abnormal. When we say dyslipidemia, lipid profile have 7 parameters, as I told you earlier. It includes estimation of TSG, LDL cholesterol, HDL cholesterol, free fatty acids. And obese persons, they do develop gallstones because cholesterol, most of the gallstones, they are cholesterol stones. And they also are victims of this cancer, as we have discussed, that endometrial, ovarian, and gallbladder and colon cancers. They may have some respiratory disorders. They are subject to osteoporosis because of the increased weight, that is the weight on the weight bearing joints will lead to osteoporosis. And because of this overweight or obesity, they have some psychological problems. Now, how this diabetes, obesity, or excessive this fat deposition can lead to these disorders, I will give you the explanation of this. Now, what happens? That obese individuals or overweight individuals, if we go for their lipid profile, they have increased free fatty acid concentration, they have increased cholesterol levels and they have increased triglyceride cholesterol levels. Now what happens? As I told you, that excessive consumption will give us increased amount of TAG. TAG go and get deposited into the adipose tissue. Adipose tissues have insulin receptors. Now, in overweight or obese individual, the number of insulin receptors are decreased. Now, what happens? Insulin is a hormone which is released when there is a hyperglycemia. Immediately after carbohydrate absorption, the blood glucose level rises, and this goes and stimulates the beta cells of pancreas, and pancreas will release insulin. Insulin is a hormone, it binds to its receptor. So when the number of receptors are decreased, what will happen? The insulin will not be able to mediate its action. So blood glucose level will remain high. Glucose cannot enter into the cell, and this will lead to hyperglycemia. Number one. Number two, since the cells are not getting their due glucose, they will send signals again to the pancreas. Pancreas will release more and more insulin. So the second effect is, first effect is hyperglycemia, second effect is increased insulin levels in the circulation. Now ultimately cell are starving, उनको तो ग्लूकोज नहीं मिल रहा, वो क्या करेंगे? They will now activate a enzyme that is called as hormone sensitive lipase. हार्मोन सेंसिटिव लाइपेज क्या करेगा? वो जो आपका VLDL है उस पे जाके एक्ट करेगा एंड इट विल रिलीज फ्री फैटी एसिड्स. ठीक है? सो इन द ब्लड फ्री फैटी एसिड लेवल भी बढ़ गई. अब तक क्या हुआ था? व्हाट विल हैपन? फर्स्ट हाइपरग्लाइसीमिया, क्योंकि ग्लूकोज सेल के अंदर नहीं जा रहा. मोर एंड मोर स्टिमुलस विल गो टू पेनक्रियाज, मोर एंड मोर इंसुलिन विल बी रिलीज, तो हाइपर इंसुलिनीमिया हो गया. सेल इज स्टार्विंग, उसने VLDL को टारगेट किया, फ्री फैटी एसिड्स बढ़ गए. नाउ दिस फ्री फैटी एसिड्स, नाउ सेल इज यूटिलाइजिंग दिस फ्री फैटी एसिड्स फॉर एनर्जी पर्पसेस. This free fatty acids again a substrate for cholesterol, और कोलेस्ट्रॉल सिंथेसिस बढ़ गई. सो फ्री फैटी एसिड भी बढ़ गए, कोलेस्ट्रॉल भी बढ़ गया, ब्लड ग्लूकोज लेवल भी बढ़ गया, इंसुलिन कंसंट्रेशन भी बढ़ गई. नाउ सो व्हाट विल हैपन? These obese person now have higher blood glucose level, decrease glucose tolerance, and I must mention you that 80% of the adult onset diabetics are overweight. Simply by reducing the weight, type 2 diabetes can be, in most of the cases, can be cured. Now, this hyperinsulinemia, अब ये क्या करेगा? It will go and it will stimulate the sympathetic nervous system. The sympathetic nervous system will lead to sodium and water retention. जब आपके सर्कुलेशन में सोडियम रिटेन होगा, वाटर रिटेन होगा, क्या होगा? ब्लड प्रेशर विल increase, and simultaneously they will also cause vasoconstriction. So these three factors, retention of sodium, water and vasoconstriction, will lead to hypertension. So hyperglycemia, hypertension, hyperinsulinemia, increased free fatty acid, increased cholesterol, increased TAG, and ultimately one can conclude that obesity is a primary risk factor in coronary heart disease, hypertension and diabetes. So this slide is giving you the basic concept of the pathology, what is going on, how this obesity will leading to the hypertension, heart disease and diabetes. This last slide is about what should be the proportion of the macromolecules in optimal nutrition. The current diet shows that the 42% of our content, dietary content, should be from the fats, and out of this 42%, 16% should be saturated fatty acids, 19% is of monounsaturated, and only 7% is from polyunsaturated. But for the future, they have recommended that in future the energy content of the lipids, as far as concerned, it should be only 30%. 12% should be of protein, and the rest of the 58% should be from the complex carbohydrate. Now, as far as the fat content is concerned, they recommend that 10% should be from unsaturated fatty acid, 10% should be from monounsaturated fatty acids, and 10% should be from polyunsaturated fatty acids.